Well, the flu bug is bringing a little less sting this season. Last year, you'll recall, the H1N1 pandemic saw hundreds of people, thousands in fact, lining up for free vaccines over several weeks. This year, only certain groups qualify for the free flu shots, and island clinics aren't seeing a whole lot of action right now. Mary Beth Burton reports.
Flu shots are available on Vancouver Island, but not many people seem interested in them.
It's quiet, yes. Certainly this year we have seen a drop in the number of people who are wanting to get flu shots. And that's probably just because there isn't a pandemic. There isn't so much media coverage. People aren't being constantly reminded to go and get their flu shot.
We are experiencing very mild activity for influenza, not only on Vancouver Island, but all across BC and in fact all across Canada.
Remember last year, flu shot lineups went on for hours. Both the regular flu shot and a separate free H1N1 shot were available everywhere.
We've been here since about 8:45 this morning. It took about 4 hours to be able to get through with a blue ticket, which is your registration. And then what you do is you get this yellow ticket and a white ticket if you get both vaccinations.
There were daily updates from the provincial health officer on the pandemic.
I mean, the delay in offering the vaccine isn't what anybody hoped to see.
The media blitz proved effective. When the season ended, roughly 400 Canadians died of H1N1. That's well below an average flu year. Public Health Canada says 750 to 2,500 Canadians suffer flu-related deaths every year. So why isn't public health pushing vaccines like they did last year?
The precautionary measures that we're taking around influenza haven't changed. We still urge people to stay home if they're sick so that they don't spread the illness to other people, to get their vaccinations. That's always important. Always to wash their hands and to exercise good coughing and sneezing etiquette.
This year, children under 2, seniors over 65, people with chronic health problems, and medical professionals get free vaccines.
There is a less invasive option to the flu shot. It's called Flu Mist, a nasal spray, but every pharmacy we tried today didn't have it in stock.
The BC CDC says 95% of reported flu cases this season are influenza A. The season can run from October to March, so we may not be out of the influenza woods yet. If the flu strikes in January, many people are ill-prepared for it.
Ideally, people do want to start getting vaccinated in October because it does take a few weeks to actually build up enough antibodies to have an effect. So if you know you are getting vaccinated now, you're not going to have full coverage, say, tomorrow. So certainly people, the sooner they can get vaccinated, the better.
VHA flu clinics run for another 5 weeks. Contact your local public health unit or family doctor for more information. In Victoria, Mary Beth Burton, A News.